Yeah, it's a pleasure to be connected on a World Cancer Day on 4th February. Firstly, I would like to thank Dr. Amina Yasmin for asking me to join for the event. And unfortunately, as of the time difference and my prior engagements, I'm here by sending my recorded presentation. So I would just quickly go on. Probably I'm the last speaker and I would not take much of time. Here it is. So let me push up my presentation from the beginning. Yes, you're not alone. We can, I can. Just when the caterpillar thought the world was over, it became a butterfly. So this is, of course, yes, and you can see me how I'm sitting and I'm recording and I'm just talking to you. Yes, this was me 3 years back. Yes, it's not a. Yeah, most of my colleagues and my friends and my classmates are here who know me since last 20 years and about that. And yes, it's last 10 years I've been away from the world and lots of things and lots of transformations. So yes, this is what I can say. You're not alone. We can, I can. First of all, being a cancer survivor myself after fighting cancer for last 1.5 decade, 2007 was my first diagnosis. And since then till now, being a cancer survivor has not been easy, but still, Alhamdulillah, I am here. So that's why I said when the caterpillar thought the world was over, it became a butterfly. So let me go on quickly to the presentation. Okay, uh, here it is. So here we are. I hope from the current slide. Sorry, I'm just recording. Okay, here. So obviously, I say exploring myself. So each and every time I tried to be things. These are some of the clippings of my trip to Tehran about a year back and exploring myself and, looking around, traveling, exploring and warming up and a lot of treasure. So you can also see me sitting there with some of the treasure manuscripts and other things. So my main aim was exploring myself. Probably the print screen is not working. Uh, anyway, I would prefer the presentation this way. So here we are here. So yes, of course, you can see me here. What can I say? You can see me here with, yes, you can see me here with my bloated body and you can see me now here. And yes, of course, this was me about 3 years back. And of course, the steroid, I mean, the body was not responding a lot of things and the blood sugar was very high, but I did not touch any diabetic medicines. And yes, some of them know that I did not. I'm completely a person with natural remedies. So yes, that's how I built my whole setup towards myself. Probably looking around to the metabolism of the body. That was my first concern as I moved to Germany, like how the metabolism can help to heal yourself. How is the body transforming? What is the cancer cells? And always it was a thing. So this is then you carrying the herbs to Germany was quite difficult. So I had to dry them out, bring them to me, and this turned out into the capsules and going around. I prefer to speak about myself today because that would be thing. So the steps involved, the 4 steps involved for today, what I'm like, everybody is saying, be what you are. So just be what you are. And the second point is getting cancer is not a sin. So you've not done it's not a sin that you have it done in your life. And yeah, she was traveling, this one, that one, maybe she's done some sin and that's why she's God. We are what we eat, and love yourself. So, yes. So, confidential information, do not copy. So, you are yourself a confidential information. I always prefer to say this is everybody's human body, everybody, and you all are with the confidential information. So, please do not copy. Yes, this was the most important things. What I felt was really necessary was we need spleen detox. because you're going through a huge stress. And of course, then colon cleansing, anti-inflammatory and antioxidant diet, increased immunity, supplements, vitamin B3, vitamin B12, blood thinners, blood purifiers, coolants, meditation for helping in oxidation of blood. So if you meditation doesn't mean you're just sitting down and doing yoga or something like that. Meditation can also mean sitting down and doing zikr, just sitting silently, doing nothing. So what about therapy bath? Just if you don't feel like, if you feel your body is heavy, just go and standing in below the water itself is a treatment. Vitamin D3, antibiotic, antibacterial. So yes, some of the things what I took for my spleen detox was wheatgrass juice, 1 glass every day, empty stomach, right? And the root of the dandelion is incorporated in dietary supplements, asparagus stem in the diet, because these were available here in Germany as I'm living here. Then colon cleansing, we all know, we all have almond water, almond oil, and 1 cup of water every night before sleep. Mint and warm water in the morning, empty stomach before the wheatgrass. So yes, oxygen level, checking in the oxygen level. Like, how do you check your oxygen level? Keep on checking. You keep on looking for patients or for those survivors or something, you have this problem of oxygen. So just check your oxygen level. Then of course the oxidative stress. So this is the oxidative stress, like when you look into the eyes, just looking into the eyes, because you can see Ibn Sina, he always mentioned look into the eyes, look into the eyes. So that was the most important point of view. So looking into the eyes, then therapeutic, I mean, regenerative promise of the medicine. You can see all these promises, but I don't look into that. So I look into the non-invasive therapies, so which are not invasive, which is minimal less, uh, injury to the human body or detox or whatever it is. So that's why I started with my blood cell tomography, which is screening out the blood samples with the elements of the blood, the anatomy, I mean, the complete screening, just like a blood cell. So the red blood cells and the white blood cells, and also the other foliage according to the eosinophils, basophils, and the lymphocytes and the monocytes and the platelets. They give a particular norm for a certain deficiency, right? In the teenage, right? In the thing. So that's how you have to get along with it. So these are some of the images of the blood slides, and this is before the hyperion plasma, like the negative ions passing through the blood, and this is negative ions after the passing through the negative ions through the blood. Obviously this is a huge research. So this was a concept, and this is just Dr. Jaziri who made the energy therapy, who gave me the energy therapy that was a negative ions through my human body, and how it healed me. So that was a concept to the clinic. You can see Dr. Jaziri there, and it's me there when he visited us in Germany with in our developing center. And this is some of our innovations which we are coming out, and how to bring up the things. Yeah, so yes, we have Dr. Josie here. I'm very thankful to Dr. Sachidananda who visited us to Germany. I'm sorry I cannot attend the session here, unfortunately, and Dr. Sunil here and Dr. Jaziri. So we had this here. So he was also here to experience, and he was like quite surprised, like bringing how the things are together. So yes, so this is a small little things. We are in the lab and working with the blood samples and looking how does it work with blood and beetroot juice and everything, all the concepts of it, even water. So here we have also the lab training setup and how we worked out on the setup and something like this. So non-drug therapy is all our medicines turning into the capsules. When I start prescribing people to take medicines, they ask me, what are you doing? What are you prescribing? So yes, so yeah, that's a herbs in the capsules here. You can just Google on the YouTube and you can see the videos. Yes, the treasure of the green fresh in India. This itself is enough, like to have your enough bounty of your iron and multivitamins. So yes, this is oxidative stress. That's the main reason of the whole system. So we have you can look into the concept of the whole system of the thing, absorbing replication, and that's the way forward. So self renewal, that is purity, identity, and potency. This is how you need to go further. So this is actually the chemistry of your blood, where you look into the prevention module of it. Of course, the medicine plants, I did the database and medicine plants of Unani, so you can have enough of the information there. You can rope in according to the diseases and you can choose. So continuing with technology, so let us join to serve humanity, that is connecting with the technology. And yes, yeah, sorry. Yeah, so we have a panel discussion today evening around 8:30 Indian time. Yes, of course, that's me today. Probably it's like, yeah, during the snow, and this was just on Sunday. And from this to this, it's really taken me a long journey to be where I am. So yes, probably I'm just thanking all of you to give me time here and to be a part of it here. And unfortunately, I'll try to be in the morning. Yes, it's almost midnight in India that I'm recording this video to Dr. Amina Yasmin for her seminar, and I wish her success for the seminar. And yes, we all pray that we are all safe in the Corona times. And Alhamdulillah, we are back. So yeah, thank you so much. And yes, maybe inshallah, see you sometime this life. So thank you so much to all of you. Sorry, I'm just like, yeah, it's midnight and I have to leave early in the morning, and I would not be able to attend directly in virtually. So inshallah, Dr. Amina hosts a seminar or a conference, which is, real, where all of us are meeting together, where we can see face to face than the virtual world. So yeah, thank you so much.